Good day everyone. In this video we will be discussing the pulmonary surgeries. Number one is pneumectomy. So it is the removal of entire lung. The main modification of this is radical pneumectomy. In this, the mediastinal lymph nodes, covering of lungs, that is pleural membrane, and parts of the chest wall, it may also be removed. And mainly the resulting cavity, it is filled with the protein rich fluid and fibrin. So the cavity size is reduced by lateral shift of the trachea and heart and upward shift of the diaphragm, and there is a reduction of the intercostal spaces on the operated side. So this is a modification called radical pneumectomy. Second surgery is lobectomy, in which there is a removal of entire lobe, sometimes with the section of the thoracic wall. So if the tumor is in the upper lobe that protrudes into the main bronchus, so in that case a cuff of main bronchus can also be removed with the lobe, and the remaining lung and the bronchus is joined to the trachea. So this modification of lobectomy is called sleeve lobectomy. Third is the segmental resection. So a bronchopulmonary segment is removed with its segmental artery and bronchus. Next is the wedge resection. It is the removal of small part of the lung tissue. This is non-anatomical resection and is used for diagnosis in the open lung biopsy or for the treatment purpose of well localized peripheral carcinoma in the patients with reduced lung function. Next, we are discussing the journal complications that could occur due to the pulmonary surgeries. Number one are the respiratory. There could be infection of the lung tissue, consolidation or collapse of the remaining lung tissue. Pneumothorax can occur. An important complication called bronchopleural fistula can occur. This occurs when the stump of the bronchus, from where we have removed the lung tissue, it breaks down, and the fluid from the space left by the removal of the section of the lung, it drains into the healthy bronchus. So main clinical features, if there is bronchopleural fistula complication occurs, the clinical features will be tachycardia, spiky temperature, productive cough. Mostly the bronchial stump after the pneumectomy, it heals within 2 weeks. So during these 2 weeks we have to position the patient so that the stump does not contact with the fluid. So in this, the position of the patient should be on the operated side lying. Another complications are the circulatory complications that may include the deep vein thrombosis, cardiac arrhythmia, any hemorrhage can occur. Thirdly, the wound related complications can occur, like the infection of the wound, the scar is or the incision is failure to heal, and also there could be a complication of adherent scar can form. Another complication is joint stiffness, mainly shoulder and shoulder girdle joints, they are stiff. Thoracic spine can stiff, and costovertebral joints are affected. Another common complication could be the muscle weakness. Mainly the muscles involved will be latissimus dorsi, serratus anterior, or any other muscles which are divided due to the incision given during the surgery. And another complication is a postural deformity. So mostly there is a tendency of the patient to lean towards the scar. So they have to protect the scar, so they just lean towards it. So there could be scoliosis and forward flexion. So scoliosis will be concave on the